Today I'm going to talk through utilizing a bridle in the operating room. Bridles are a securement method used to secure various types of tubes. We've used them for novocatheters, for Salem and Anderson sumps in the operating room, for nasal jejunal tubes, and for nasogastric tubes, both in the operating room, outpatient, and as well as on the unit. And so today I'm just going to walk over right here. I've got my model. I already have a nasogastric tube in place. We're going to pretend this is a Salem or Anderson sump for the purposes of today's teaching. And then this is my bridle. What you may be familiar with is the older style of bridle, which is more of the umbilical tape type. This is a more difficult tube to place in my experience and requires a lot more lubricant to get the tube to be secured behind the vomer bone. This product is newer, and this monofilament tube is much easier to slide around the vomer bone. And that is the product that we would recommend to use in the operating room as well as on the unit. So today I'm going to walk through how to place that. There are two tubes. One is just a stylet probe that has an earth magnet at the end. The other stylet, this becomes removed as you're doing the procedure. So we'll talk through that. And it also has an earth magnet at the end. The way this works is this connects using these strug magnets behind the vomer bone, and then you can easily slip the monofilament tube around the vomer bone and secure this clip into the tube of whatever kind of tube you're using. So if you have your patient and you have your tube in place, I always recommend keeping your wrists high when you're placing, putting one probe into one nares, putting the other probe into the other nares, and you kind of go back behind that vomer bone, twist until you feel the tubes connect. You'll hear a click and you can kind of feel that happen. Remove the stylet partially and then pull with the other probe. You can see that that's connected. So you can completely remove the stylet, gently pull around the vomer bone. You can use some lubricant if you feel like that's necessary. You insert the tube into the clip. Insert the other monofilament tube into the clip. And if you look closely, you can see ridges here where those tubes are supposed to fit. One of the most important parts about placing a bridle is knowing the distance above the upper lip and below the nares. You want to get that properly secured. And then you clip the tube and you'll hear that snap. Make sure it feels secure. Also, you can test that the tube is patent and that it's not occluded by the clip. And then you tie one square knot above. A square knot below. Another square knot above, just to make sure it's secure. And we recommend a fourth square knot below. So in total, 2 knots above and 2 knots below. If you pull too tightly, this clip can slip up and become too tight. We have seen several nasal erosion injuries, so it's very important that this tube is not too tight to the nares and it's also not too loose where it hangs in the mouth. Now, most of the time we do not need to tape it. If you feel like you need to tape it to the face, another important point is that it's not pulled too tightly, because we've seen nasal erosion injuries over here as well. If you do need to tape it loose enough that it's not causing any pressure points around the nose, and then you can secure it with Tegaderm. And of course, you would then clip these ties as close to the patient as you'd like. Now remember, if this would become untied, you want some real estate left over here so that you could potentially use a hemostat. A tiny little sharp pointed hemostat's my favorite, or you can utilize this guitar pick to undo the clip, retie or resecure, and then make sure that you're properly adhering it to the face or just leaving it to be free. And then that won't cause any skin irritation on either side of the face. And again, you want to make sure that the tube is patent, so you can draw back, test pH, or do whatever you need to do, and then make sure that the tube is working properly. Now to unsecure the clip, you can use this. Again, I really like using the hemostat to unclip it. And you could readjust if you needed to, and then reclip. Now to remove any bridle, if you're removing the bridle alone, you can unclip it clip one of the blue monofilament tubes and pull it away after you untie the knots. Your other option is if you're removing the tube and the bridle, you just need to clip one tube, one monofilament tube, and then just pull, and everything will come out in one piece. And that is how you place a proper bridle.